Good morning, my name is Airam and I'm a student nurse at Northwestern State University. Is it okay if I do a physical exam on you?
Yes, ma'am.
Okay, I'm using hand sanitizer and I'm closing the curtains to provide patients privacy. Can you verify your name and date of birth for me?
Kendall Scott, 10605.
Okay, perfect. And do you know where you are?
The hospital.
Okay, and what brought you to the hospital?
A wellness check.
Okay, do you have any change in your appetite, your sleep patterns?
No, ma'am.
Okay, do you have any pain?
No, ma'am.
Okay, if the patient had any pain, I will assess using all cars, so onset, location, duration, characteristics, any aggravating factors, any radiation, any treatment, and severity, or also the onset of the pain when it started. Patient has no pain, so we're gonna move with the eye exam. Also, patient is awake, alert, and oriented times 4. So for the eye exam, I'm gonna place this paper over your head and I'm gonna shine this light, okay? Okay, so look straight. Okay. Now can you follow this pen light? Okay, and now look at this. Okay, perfect. Patient pupils are round, equal, and reacted to light and accommodation. Now I'm going to assess, that was cranial nerve number 2, 3, 4, and 6. Now I'm going to assess cranial nerve number 5, 7, and all the way through 12. Can you raise your eyebrows? Okay, can you shrug your shoulders? Can you clench your teeth? Can you smile? Okay, can you open your mouth? Okay, patient's uvula is center. Soft palate rises symmetrically. Patient's mucous membranes are pink and soft. Now I'm going to assess cranial nerve number 8. Did you have any hearing aids?
No, ma'am.
Okay. Now I'm going to whisper some words and you tell me what I'm saying, okay?
Pickle.
Okay.
32.
Okay. And you are not wearing any contacts or glasses, right?
No.
Okay, perfect. Can you raise your eyebrows again? Okay, perfect. Do you have any difficulty smelling normal?
No.
Okay. Can you feel this?
Yes.
Okay, can you feel this?
Yes.
Okay, perfect. Now I'm going to assess the patient's abdomen. And I'm going to lower your head a little bit. Actually, let's start with the lungs. Okay, I'm going to assess the patient anterior side. Okay, now I'm going to assess the patient's posterior side. Can you sit down for me? Okay, and give yourself a hug. Yeah, perfect. Okay, now I'm going to assess the lateral side. Can you sit up for me? So the right side has 3 lobes. And the left side has 2 lobes. Okay, patient lung sounds are clear now I'm going to assess the patient's heart, and I'm going to start with the aortic valve on the right side, and that's going to be the second intercostal space. Pulmonary valve on the second left intercostal space. Erb's point on the third intercostal space. Tricuspid valve on the fourth intercostal space. And my mitral valve on the fifth intercostal space. S1 and S2 are heard distinctly. Now I'm going to assess the patient's abdomen. And I'm going to lower the bed. You said you had no pain at all, right?
No, ma'am.
Okay. Do you need to use the bathroom before we start?
No.
Okay. Are you comfortable?
Yes.
Okay. so I'm going to start by inspecting the abdomen. Can you do a crunch and kind of cup for me? Okay, I don't see any hernias. Patient abdomen is flat. Now I'm going to auscultate the patient, and I'm going to start on the lower right quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. Okay, they were both sounds on all four quadrants. I'm not going to percuss. If I were to percuss, there would be like a tympany. Now I'm going to palpate the patient. Is it okay if I lift out your shirt?
Yes.
Okay. And I'm going to assess on the same pattern. So I'm going to start on the lower right quadrant, upper left quadrant, upper left quadrant, and lower left quadrant. Okay. Patient has good hygiene. Skin is dry and according to patient's ethnicity. Now I'm going to assess the patient's upper extremities. So I'm assessing the temperature. Okay, patient temperature is warm. Skin color is equal on both sides. Patient has no edema. Now I'm assessing the skin turgor. Okay, instant recoil, patient seems hydrated. Now I'm going to assess the capillary refills. Okay, capillary refills is less than 2 seconds. Now I'm going to assess the radial pulse. Okay, radial pulse is 2+, they're equal bilaterally, and pulse is 72. Now I'm going to assess the patient's script. Can you hold my fingers? Okay, perfect. Strength is equal on both sides. Now I'm going to assess the patient's lower extremities. Okay, skin temperature is equal on both sides. There's no edema. Now I'm going to assess the patient's dorsalis pedis pulse. Okay, they're equal, 2+ bilaterally. Now I'm going to assess the patient's capillary refills. Okay, 2+. Capillary refill is less than 2 seconds. Can you push my hands towards your head? Okay, perfect. Now push like a gas pedal. Okay, perfect. Strength is equal on both sides. Now I'm going to ask the patient to turn to your right side, looking at the wall. Okay, perfect. I'm assessing the back of the patient's head, the scapula, the coccyx, and I'm assessing the patient's heels. There's no lacerations, no pressure ulcers. Can you roll back? Okay, perfect. Now I'm going to sit up the patient. Okay, is that comfortable?
Yes.
Okay, I'm gonna lower the bed of the lower setting. Okay. Do you need to use the bathroom right now?
No.
Okay. You say you have no pain. Is that still the same?
Yes.
Okay. So patient has all of their belongings within reach. Patient has no IVs, no electronics hooked to the patient. Again, patient has no pain. No need for the bathroom. And I guess that's all for us. Thank you so much. And if you have any questions, here's the call line. Let me know if you need anything. Okay. All right. Thank you.
Thank you.